Okay, we are now entering into week 8, and this week is a very important week. All weeks are important, but this week is especially important because it is your midterm week. You should if you look at your syllabus right here, you'll see that you have Sunday night, you have your chapter review done, and that closes December 1st, but I would do all your homework before you do any attempts on your midterm. And make sure you do your discussion posts. Those close every week, so you don't want to be late with that. So let's look at this week right now. We're moving into week number 8, and it's our midterm exam and our review post. I want to go over what's going to be on the midterm, and I also want to go over the review post. So from here, from your syllabus, you should be able to click exactly on. So let's do the review post first, okay? So what I'm going to have you do here is that this is worth 10 points towards your midterm final exam. So doing this will be very important. You don't want to get a not submit. So don't do the thing where if you feel overwhelmed and you don't submit. I want you to attempt no matter what, and know that on Thursday I am going to have a Zoom meeting so that you can go. I will go over this again in person if you have any questions. You've been charged to develop a behavioral change project for an individual. So let's say in real life, and this happens a lot, if you're a health educator, a nurse, any type of health practitioner, you have to help people with changing their behaviors. Below is a list of goals. I want you to develop a plan and a way to measure if it was successful. Keep it realistic with SMART, specific, measurable, attainable, and realistic goals, and I'm going to tell you how to do this. Here's the situation. Josie has a stressful job and often finds that she's overwhelmed with panic attacks and feelings of dread. Poor Josie. Anyway, she has come to you to discuss how to address these issues. To cope with her stress, she's taken up an addictive habit. So she might be coping with using alcohol or marijuana, or she might be eating. Eating is also a way to cope with pain, or binge watching huge amounts of Netflix. It could be anything. She also does not have a healthcare provider or any type of insurance. So 2 things should be going through your head right now. 1, is mental health your thing? Have you been trained to help her through addiction? No. If you haven't, which in this case, I'm going to say hypothetically, you have not. Your goal is to get her into a healthcare provider, to get her set up with a behavioral support plan, and to hopefully get her insured or some type of coverage insurance. So start to think about what are some things that will help her long term. You can't address all of Josie's issues, but you can identify one and come up with a plan. So it could be getting her into health and care insurance, or getting her to start to do some self-reflection. So the first one might be that she will look at these 3 different goals. And I kind of narrowed it down for you so that you wouldn't have to feel like you had to take on everything. And let's pretend also that hypothetically Josie's not in a critical stage. She's starting to pick up a habit that's bad, but she's not an alcoholic yet, or she's not doing something that's self-destructive, okay? So this is just Josie in a way right now just wanting to become healthy. Here are one of the goals that you need to select from. You can either do to reduce stress through relaxation strategies. You can have her start to work on meditation, exercise, getting into a support group, okay? That's goal number 1. You could help her quit an addictive habit, and I'm going to change this to say a potentially addictive habit. So she's not gotten to the point where she's completely taking on something to completely cope with it. But for example, she might be smoking, which is an addictive habit, but she's just starting it. She's experimenting. Drinking, let's say she's starting to push from a moderate drinker to binge drinking. She needs to start self-reflecting on her drinking. And then drug use, you could have her starting to experiment with a drug, but the reality is that most drugs especially the ones like cocaine and meth, are extremely addictive. So when you go into the drug use, you need to make it very kind of a light drug. So for example, like she's taking antihistamine every night to go to sleep. She's doing something very minor, but that could grow into something big. And then 3, probably one of the most important ones that you could do is help her figure out how to access healthcare. And so this is where you would probably need to go out to Coverage California, try to ask her what healthcare options she has, because getting into a high quality doctor is probably one of the most important things. So you could choose one of the 3 goals. After you select one of these 3 goals, you're going to pick one of the models. Remember when we did that in the very beginning of the semester? You're going to either predict the health belief model, which is, perceived benefit, perceived susceptibility. Read up on this before you dive into it, because I can tell when someone doesn't know what the health belief model is. The health belief model is about people thinking that they can get a disease or thinking they're at risk. It's a thinking model, okay? The second is the trans-theoretical model. This is the one that you take someone through a series of steps of change, and whether they, where they're pre-contemplating, contemplating action. So you're going to assess where Josie's at now and then take her through that model. Or the social cognitive model is about really getting social supports for her. So hint, hint, if you decide to put Josie in a support group, you're going with a social cognitive model, okay? So each one of these, read up in your book. It does a really nice description in your book of each one of these models, and then hit on it. And then plan is you're going to come up with the specific goals. So here's something that's really important. You don't want to give goals to Josie that are lawfully, that are not attainable. So you need to make them really attainable for Josie. What's realistic? Don't shoot for the moon. Get something that she can do in the next 3 months that's really real. So if you decide to put Josie in a support group, the first month you have her research support groups. The second month you have her put on her calendar that she attends 2 of those support groups. The third month, she's now starting to maintain those support groups, and she's going every week to a support group. That's the trans-theoretical model. Okay, I just gave you an example of that. So you actually give her something attainable. If you decide to have Josie go on an exercise plan, which is the trans-theoretical model, you could use that one. You set up really specific goals. First is maybe she just goes for 15-minute walks. Next, 2 times a week. She starts bringing her tennis shoes to her work, which, by the way, is a good cue to get her to start walking. Okay, and so you start working through each one of those to give her something realistic and attainable to do. And whether you could also do this thing where she's meeting with a group of friends to walk once a week. That's the social cognitive model, but you give her something very specific that she needs to do each week, and you build on it, and you make it realistic and very doable. If you decide to get her into a really good doctor or a healthcare model, then you're going to need to make sure that you research her insurance. What does she qualify for? Get her to actually fill out the paperwork. Set reasonable goals for her that she can actually attain. And you measure that. You go back to Josie. Did you get that done? Did you get it done? Did you get it done? It's like a checklist of things to do. And then the evaluation is you come back after like a week or 2 weeks and you say, how far did you get on your plan, Josie? What did you get done? And if she didn't do it, you start to say, what were the barriers? Why didn't you get it done? Let's talk about what we can do to help you to get that done. And that's basically a plan. So I want you to just come up with a plan. It's it's 1 page, and you use this, you can cut and paste this into a 1-page document, and then you're going to post it in Word in here. So I I have, you can upload a file, you can type directly into it, but, and I will be adding a rubric onto this, so that I will be grading against this rubric. So look at the rubric to make sure that you're hitting everything in the rubric before you post, okay? So that will be going up. The second thing is that after you finish this, the next thing you should really work on is that you have a midterm. And your midterm is going to be covering all of these areas: accessing your health, promoting and preventing. So I list all the different areas. And I'm taking about 5 to 7 questions from each of the chapters. And hint, hint, do your chapter reviews before you do this midterm. It will be timed. It will be 60 minutes. You will have 2 attempts. And then I'll show the correct answers on October the 16th. And what you need to know is that I will accept it all the way till Monday at midnight. So what that does is that I'm putting a deadline in there that will close on October the 16th. And so let's see here. So you will have the ability to go up until that time. So I'm looking right now to make sure. Yeah, so it's going to close on October 16th, which is a Monday at midnight. So what I would do is I would make sure that you get your 2 attempts in before that time. Make sure you can try to get it all the way up to 50. If you have any issues, don't wait to the last minute, because if you have any issues, then it can't be addressed. So do it before that time frame. Do it before, get on high-speed internet, and make sure you're good to go. Okay? So that is what you're doing this week. This is what this week's about right here. I'm going to my modules now. And you can see we're moving into week 8, and these are the 2 things that are posted. So what are the 2 big things that you need to keep in mind? Do all your homework before you start the midterm exam. If you have any questions about your midterm review post, I will be posting a Zoom. And the Zoom will go right in here. You can see it, and it will be on Thursday. You can watch the recording, and I will be available to answer questions on Thursday night. Okay? Again, Canvas, message me if you have any questions, and I look forward to seeing your review, midterm review post, your behavioral change post, and I look forward to seeing your exam results. I think you guys will do great. All right? Great. Have a great week, and I look forward to answering any questions that you might have.